I saw a patient who had a prescription of -24, and they had seen several other surgeons, 3 in fact, and had been told, hey, you're not a candidate for Evo Icl surgery, and you're not a candidate for Lasik, you're not a candidate for PRK. And in those instances, those surgeons were both right and wrong. Yes, doing ICL surgery alone cannot treat a -24 prescription. ICL surgery can really only top out around -16 to -18 diopters of nearsighted correction. Lasik cannot treat even half that prescription, and same thing with PRK. And so in this situation, the patient's anatomy was actually such that we were able to combine both the Evo Icl surgery as well as with Lasik. And so what we ended up doing for this patient was we did the Evo Icl surgery, intentionally debulked about 70 to 80% of the prescription, and then waited 3 or 4 months later and then treated the rest of the prescription with Lasik. So yes, the Evo Icl surgery can be combined with Lasik or PRK and SMILE in certain instances, but it all really just comes down to the patient's individual anatomy. We need to make sure there's enough room in the cornea still to do the rest of the treatment after the ICL surgery has been done. And we obviously need to make sure those scans are normal as well. But sometimes for these patients who they're just not a candidate for one surgery just because their prescription is so large, if all lines up properly, sometimes we can utilize 2 surgeries to get the job done. And that's one of the things I pride myself on as a vision correction surgeon, is custom tailoring a solution to each patient. Not everyone's a good candidate for surgery, but for those patients who are, sometimes if we combine 2 different technologies, often we can get the job done.